Hi everybody, my name is Dr. Dave Harvitz. I am a physical therapist with Renew Concierge Physical Therapy. And today what I'm hoping to do is take a video of a typical evaluation that I would do for you when I first meet you in the home. Remember, I am your 100% mobile clinic, which means I come directly to you and add convenience to that. Your healing journey starts on this visit, and so what I'd like to do is introduce you to a patient that I'm starting with today and show you what it looks like to be introduced to the Renew way of doing things. So what I'd like to do first is introduce Matt here. He's invited me into the home, and what we're really trying to do today is an initial evaluation. Real quick, we did do a quick medical history off the camera, mainly to get all the information. I did want to highlight a couple things for you, and so one is, Matt, how long have you been having this pain?
It's been close to 30 years now.
30 years, and then why do you think this happened?
I had an accident at around 21 and 22 years old.
Okay, and you've had pain since?
And I've had pain since.
Now, did you get any type of therapy or treatment afterwards?
Yes, I did. I had immediate therapy, but there was no relief. Chiropractic with no relief. Yeah.
Okay, and have you had that throughout the years, or just kind of here and there, or just that was your one thing?
I've had therapy throughout the years.
Okay.
And still no help.
All right, and then so why? So here I am. I'm a physical therapist. Why have you decided to call me in?
I heard about you through a friend, and they got a lot of relief. I'm still a little bit skeptical because of the treatment that I've had in the past, but I just want to see what you can do and just give it a shot.
Yeah, well, I'm looking forward to showing you what we can do with Renew. Okay,
Awesome.
So let's get started. All right, Matt, so on a scale of 0 to 10, 0 being no pain, 10 being emergency room, what would you rate your pain level right now? Not doing anything.
Right, about an 8.
8. Okay, all right, now that's pretty high. You're sure that, emergency room's 10, you're there.
That's pretty bad.
Okay,
yeah.
So let's have you bend forward for me. Let's see if that changes anything. Any pain? Come back up. So that doesn't increase your pain, but it's still there. Let me have you bend backwards for me, okay? Hands on your hips. And
Oh, yeah.
Okay, all right, so where did that hurt?
That's lower
Okay,
right.
lower
yeah.
right. Arms to your side for me. Go ahead to your right. How's that feel?
Yeah, little pain.
A little bit,
yeah.
sure, but it looks like you're about halfway where you should go. Let me have it to the left.
Yes.
Okay.
Yeah.
Right side really hurts. Okay, that all is lower pain.
Correct.
Okay, now let me have you stand here and rotate. How's that feeling?
That's a little painful.
All right, does it hurt down below?
No. It's
Okay.
upper. Yeah.
Up, it's a little higher. Okay.
Yeah.
What about this way?
Yeah.
Same thing?
Yeah.
Okay, very, very good. All right, so now that I got that, let's get you on the table. Let's check some more things. All right, so now we've got Matt on his back. I've now completed my range of motion assessment, which really tells me a lot about what's going on in his back and the mechanics of it. It really helps me assess his facet joints. It also screens out a lot of times herniated discs. And so what I'm doing now, I'm already thinking he's got a pelvic alignment issue, and so we've already done a neurologic assessment on him. I have cut that out. And so what I want to do now is take you through some of the alignment assessments here. And so what I'm going to do, Matt, I'm just going to give you a little pull. Don't resist me. And what I'm doing here is just making sure that he's actually straight. What I don't want is his pelvis being off when I'm actually trying to assess if things are actually straight. And so here I'm already seeing that this leg is short. I'm seeing that this right hip is a little bit lower. And so let's have you lie on your stomach for me, Matt. So the same thing, Matt, I'm gonna give you a little pull here. Just let me pull you, don't resist me here. Again, just making sure he's straight. What we're gonna do, we're gonna look below here. And again, I'm already seeing that this right side's a little bit high. And then here on the sacrum, is that a little tender right there?
Yeah.
All right.
Yeah.
Go ahead, why don't you go ahead and just kind of lift up on the table on your elbows, kind of like you're doing a push-up on your elbows.
Yeah.
Okay, I get you. All right,
Yeah.
Go back down. All right, and so again, that tells me what's going on in the sacrum. And so now what I'm gonna do is gonna kind of start assessing his lumbar spine. How's that feel?
That's not so.
Okay.
It's not too bad.
All right, and here, again.
That's okay.
All right, so let's try a little, what about like right in here?
Yeah.
Okay.
Yeah.
Again.
Yeah.
Okay.
Yeah.
All right, so I'll leave that up to you. We'll deal with that another time. But obviously what I'm seeing here is he's got some stiffness in his upper back, and he's got some stiffness in his sacrum and pelvis. So what we're gonna treat it right now. So Matt, let's have you flip it back over to your stomach, or off your stomach. All right, so let me have you bend this knee up. That's it. What I'm gonna have you do is you're gonna push down like that you're gonna push your foot that way.
Okay.
Okay.
All right.
I'm just gonna hold you here. Go ahead and push for me. Good. And rest. Good. Relax. Let it go. And again, push. Push, 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 push. Good. All right. And relax. Let it go. And again, push for me. That's it. And rest. Good. All right. So let's see what we got. So what I'm trying to do there is just trying to get that pelvis to be in better alignment. And so that's already looking a little bit better. All right, and so instead of getting you back on your stomach, let's just have you stand up for me, and let's take a look at that. Be gentle. Now, what would you rate your pain level?
Like a 2?
Okay, so that's feeling better. Good,
Yeah.
good. All right, so let's have you extend back and see if that's even better.
Yeah.
All right, so that's
Wow.
feeling even better.
Yeah.
Let's have you bend forward. This should feel pretty good. That wasn't a problem for you in the
Yeah,
past.
I'm good there.
And so let's have you twist here. Let's have you twist. Again, how's that?
That's better.
Okay.
Yeah.
Again. All right. So now we're hovering around a 2. Is it pinchy or is it more achy?
Just so achy, sore,
Okay.
like a muscle sore, but not pinchy at all.
Okay. Very good. So now let's get into the last segment of our treatment. Let's have you lay down on your back here. All right. So at this point now, I really feel like I've cleared up some of his mechanical dysfunctions, and that's kind of where I start. I want to start with the joints because most of the time it's the joints that are causing the problems. People have muscle pain, they have achiness, that happens, but muscles don't really hurt themselves. Usually they are irritated by something else, and in his case, it was definitely a rotated pelvis, it was definitely some stiff joints in his thoracolumbar junction there. And so what I want to do now is I do want to work in some of the muscles. I want to see if we can't relieve some of his pain, even more so with his muscles. And so what I'm going to do is some soft tissue work. And so go ahead and bend your knee up here. Keep this foot here. And what I'm going to do is I'm going to kind of put my fingers here in your pelvis. It's not going to be pleasant. It's going to definitely be awkward. All right, Matt. But what I want to do is right in here.
Oh, ow. Ouch.
All right, hold on now. Now, what I want you to do is you're going to move this knee out to the side. Let me get my fingers set. Okay, go ahead and come on out. Okay, okay, nice and easy, okay? Relax, relax. All right, that's why that was hurting. So, tender.
Yeah.
All right, go ahead, nice and slow. Good, now back up, all the way up and down.
Okay.
Good, all the way up and down. Good, and you go a little bit faster. And what you're gonna feel is you're gonna feel like this muscle is getting a little bit better as if I'm not pushing as hard.
Okay.
All right, and that might take, sometimes it takes 30 seconds, sometimes it takes 2 minutes, but I want you to feel
It's easy, it's like it's easing up. Yeah.
Good. All right, so what I'm gonna do is I'm gonna change my position here. So I'm gonna stay on the same muscle, but different spot.
Yeah.
Okay.
Yeah.
So what we're gonna do it again. We're gonna go back and forth. Okay. This is the portion of physical therapy that sometimes is no pain, no gain.
Yeah.
Okay. And what you'll feel is though I'm kind of releasing this muscle a little bit. Okay. All right. It might take a few minutes.
Yeah, I can tell it's easing. It's getting better.
All
Yeah.
right. We're gonna stay on this a little bit longer. All right, so from here, what I've done is we have kind of cut out a little bit of my soft tissue work. What I did do is I worked on his hip flexor muscle specifically. It sometimes takes several minutes. We did that. And so what I want to do is move on to the next muscle group. So let's have you lie on your left side. We're going to kind of check a couple different muscle groups. Okay, all right, so I found another, these are all trigger points, Matt.
Yeah.
And so these are probably the cause of your achy sore. So what I'm gonna do is just some gentle, some soft tissue work again. Some people would say it's massage techniques, that's fine. Really what I'm doing is I'm relieving some of the trigger points and some of the scar tissue buildup. Over the years, Matt, you've had a lot of scar tissue buildup because of chronic inflammation. That's part of the reason why you've been in a lot of pain. And so what I'm trying to do is kind of reverse some of those mechanical problems. Is that still hurting?
It's eased up.
Okay, so I'm going to move on. All right, and so let's see how this feels here. How's this up here?
It's not too bad.
All right, so that's a muscle group that's usually tender, but you're not feeling anything. That's good. So what I'm going to do is one more muscle group, and then we're going to be done here. So what I'm going to do is, everyone's heard of the piriformis. Right.
Yo!
Okay, it's usually pretty angry, especially with rotated pelvis and sacral issues. So what I'm going to do now is I'm going to keep your feet together, and you're going to lift this knee to the ceiling here. Okay,
Gotcha.
so go ahead and do that. Go ahead and lift up and down.
Okay.
All right, go back up and down. Good. And let me know when that starts to ease. And again, sometimes it takes 30 seconds, sometimes it takes up to 2 minutes.
It's easing. I can
very
tell the
good.
difference.
Excellent. All right. So again, I just spent maybe 5-10 minutes working on some of these glute muscles here just to kind of help relieve that. We did cut out a bunch of things that maybe weren't so relevant to Matt's problem. But again, I do a full screen. My evaluations take about 75 minutes. And so during that process, I am looking at everything. Really what we did today so far is to show you what was positive, what was relevant, and then I wanted to show you a sample of all the treatments that I use. We did cut some of that stuff out just for the sake of time. But Matt, let's have you stand up. Let's see how you're feeling now. Go ahead and again, do that standing marching here. Just kind of move that around. Why don't you just swing that hip around a bit. Good. There you go. Now, how's your pain?
I'm feeling really good. Yeah.
Any pain at all?
No.
Okay,
No.
good. Let's have you extend back.
Yeah, that is awesome.
Okay.
Yeah.
Good. Let's have you bend forward for me. This obviously felt pretty good.
Yeah.
All right.
No
And let's have you
problems there.
side to side for me. Reach, reach, reach.
Yeah,
Pain?
that's good. Yeah.
Nothing, huh?
I mean, there's soreness, but it's not pinchy. There's no pain. Yeah.
Okay, you just
It's
feel
just
worked
like
over.
Like I've been working out.
Okay,
Yeah.
very good.
Yeah.
So let's do one last thing, and let's get you on the table. I want to show you an exercise to kind of keep this going between now and our next visit.
Okay.
So let's have you stand on your hands and knees on the table. All right. So what I want you to do is you're going to bring your glutes here, your backside to your heels. All right, all the way down. Good. Now from here, I want you to take those arms. I want you to stretch it head down, tuck, 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 and stretch. You feel that stretch?
Oh yeah.
Does it feel good?
That feels really good.
Okay, good, good. I'm glad. Now back up. Now stay here in the neutral position. Now what happens is people always mess this up. I don't want you to be too aggressive. This could hurt, all right? And what I want you to do is just bring your hips to the bed without bending your arms. All right, now look up for me. There you go, good. And then back up, and then let's get your glutes to the heels. Good, head down, stretch, stretch, stretch.
Yeah. That
Okay.
feels awesome.
Okay, go back up and let's go one more time. Hips to the bed, all the way up.
That feels good.
All right, let's have you stand up here. I just want to thank you all for taking the time to experience a typical evaluation and treatment with me, and I'm very thankful for Matt allowing me to video our time together. At this point, I just want to let you know that this is typical. I do get results with people on the first visit. This is not a sham. This is not something that I'm just putting together. The reality is that traditional physical therapy, traditional chiropractic does not work like this. A lot of times it takes a lot more time, but with my process, my evaluation, my experience, what I tend to do is be more of an investigative physical therapist. I want to get down to the root cause of your problem, and then I want to address it from there. And what we see is fruit. We see fruit from the treatments, we see fruit from some of the different techniques I use, and sometimes it takes a little bit more time to hash out. In this case, it obviously was in one visit, and obviously he's going to need more time. His pain will come back, but the reality is that we work through that process, and eventually the pain will go away. He's going to need a lot more sessions, but the reality is that when we dig deep into the root of the cause of the pain, we can clip the fruit of pain and get back to normal function and normal living. And so again, if you're on my website, please go to my contacts and you can feel free to reach out either by email or phone. I'd be happy to come out and take a look at you and see what I can do for you.